So how's everything?
Well, we're in quarantine. We got plenty of time.
Illinois and Florida are both getting hit, so it's okay, man. We're even.
Yeah. So we're so I'm trying to understand this home health thing. So you're an attorney, Benji told me you're an attorney?
No, I'm a nurse.
Oh, you're a nurse as well. Okay. And you kind of work as this like a liaison for the home health?
Yeah, so my background is I've actually owned home health agencies and home care companies. So I own agencies and you know, I have my own agencies myself. And so, you know, a few years back, well, about 5-6 years ago, you know, I started consulting. You know, and so, but my consulting is more based on the marketing aspect of agency, on how to get more patients. So so like a good example is Benji. Benji is one of my pretty much most interesting employees. I mean, interesting trainees. I barely spend a lot of time on Benji, but you know, he's the one who just calls me and then we talk and I always give him strategies. That's why, you know, Benji brings in like what? How many patients a month for your agency?
I don't know. How many does he bring in? That's a good question.
He brings in somewhere around 70, 80 a month.
Wow. I know a lot of them are Medicaids. I know a lot of those because those are the ones I take. But yeah, he's a busy guy for sure.
Yeah, the Medicaids that you probably take are less than what his Medicaids are not even counted on that 70, 80 patients that he brings in.
Oh, wow.
So,
okay.
Yeah, you know, that's not even counted. He doesn't count that on his list. So he gets more of those, but he doesn't count it. And so the reason, you know, when I started working for him, I said, because, you know, we were both in the industry. Our parents were in the industry. We were taught differently in marketing. And so, you know, I changed my ways on marketing. I said, there's better, easier ways to get it, the right way, the better way, not spending too much money. And so, you know, when Benji started marketing, when he left being an administrator and owner of companies and started, I'm just going to market, I said, this is what you should do. And I just gave him the plan. And that's how he went from averaging 0 patients a month to 70, 80 in about 2 years.
Wow, so that's insane.
You know, so he himself, he can have his own agency and be way profitable already as it is. You know, so all you need in a home health is 30 patients a month, and you will have a positive ROI positive agency already. You know, if you're like a self-owner, so like, you know, if you own the agency, you know, obviously you're going to pay yourself as a DON or as an administrator. You can pay an administrator, a DON, all the visits, facility charges, and you're going to break even. But if you're
even after paying yourself,
after you pay yourself. But one thing you have to understand that a lot of agencies make a mistake, the self-owners, the mom and pop shops, is that they're just satisfied with getting paid, so they don't work for another company. And so they're satisfied with that 30, 40 patients. But when you hit that 30, 40 patient, what they call plateau, and if I see my census averaging at the same amount of patients for at least 3 months, that right there is already a red flag. Something's going to happen. You have to see a steady climb, because if you hit a plateau, there's only one direction plateau goes, and that's down. So that's the thing that you go. So you're planning to open up an agency in Arizona, right?
Okay. So steady incline. We're planning on moving out to Arizona. Yeah.
Okay.
And so, we really want to. Yeah, I mean, and you said it might take a whole 1.5 years for the process to take place.
Yeah, it does. It can take that long. Arizona, you don't have a lot of competition. I mean, there's a good amount, but not a lot. That's one thing good about the place. So starting there is a good place. And the reason why Arizona is a good place to go to, I'll tell you why. In this industry, we see a lot of, you know, minority people starting these companies. So wherever you have an influx of Asian community or African communities, those are the ones that are a lot of these agencies nowadays. And so Arizona is just one of those states where they don't go to directly and they're not opening. So your strategy there is a lot bigger, and so you have a potential to grow faster in a particular area. I mean, that's why when you see California, when you see New York, you see Florida, you see Illinois, there's a large amount of competition there because of the healthcare workers in there that's wanting to start their business. A lot of minorities have the belief you come to this country and the American dream is to open up a business. So
exactly.
Is I always tell people, I'm like, if you're going to start a company, wherever you are, don't open it up there. Open up another state where there's more, it's faster growing for you.
Right.
So that's a good choice that you're getting into, that it is going to be Arizona. I would look into thinking about opening up a non-medical in addition to your home health.
Well, I have a brother-in-law that has I might consider, I think one thing at a time, you know what I mean? One thing at a time. I would consider even a group home at some point, but because my brother-in-law owns a group home out in Arizona, and he says it's not too bad. He says he has a pretty good profit margin of about 300,000. And he says it's not a bad business to get into. He just said it's a very tough business. Sorry, let me tell my wife to call my sister. Call Emilia. Call Emilia. Okay. I'm gonna go outside here. Sorry, because it's sorry, we're like isolating and people are trying to come over. Are they crazy or what the hell? I'm sorry, man.
No problem, man. Arizona
has been a crazy
place for
days here. Yeah.
It is.
So I guess my first question would be, so you're saying it's going to take me about a year and a half just to get through the process?
Yes.
Okay. Wow. Okay. So what is, I guess, my first step?
Well, first step on everything is making a decision on, what area you're planning to target. That's number one. Okay. Start figuring out, am I ready for this? Do I have the funds for this to start a medical home health? Because there is some requirements that you have to have cash on hand on the bank, because you have to show proof to that to the government, to the application.
How much cash on hand?
70,000, 50 to 70,000 at least.
That's fine, no problem there.
Okay.
But how about the I would say my biggest concern is the time frame, like a year and a half. That is a long time to wait. Would you recommend me buying a home health instead, or is it just going to be a cost saving to just probably open my own home health?
I say open up your own home health. The thing though, when you purchase a home health agency, there's a lot of risk involved. Number one is, how was their billing practices before you came in? There might be things that come up later on, and I've seen a lot of horror stories that way. If you don't do the right due diligence, that all of a sudden they own taxes. I've even known some people that bought a home health agencies knowing that they own taxes, and they promise, instead of the owner getting money, the new owners will say, we'll take care of your taxes for you. You're putting yourself at risk on that. And so, plus also like the amount of money that you put in. Sometimes if home health agencies that are for sale, average is still around 300,000.
Oh wow. Okay.
Not unless
that's too much. Yeah.
So I mean, the way I would look at it, if I'm gonna spend a smaller amount, the fact that you're a nurse and your wife is a nurse, there's so much money that you're not having to lose because you already have the sweat equity to be able to put your name in the company and not have somebody. Because if you're not a nurse and you're starting one, you have to bring in a nurse. And, minimum, you have to pay them maybe a 20-hour work week for a company that hasn't even started yet. Just use their name.
Okay. So it's going to be a lot of like paperwork and different things we got to take care of, right?
Yeah.
Okay.
I always had the belief that I would rather start fresh, and
Start fresh. Okay.
you don't know what stigma is attached to an old company's name. So
Okay.
I would stay away from that part. Yeah, I do understand it's a year and a half, but typically why it lasts a year and a half is because also the owners lag on things. The reason for that is there's a part during your application when they say, okay, you're approved. What ends up happening next is they're going to say, now you can start admitting patients. And so, because what happens is before you get approved fully, you have to take care of at least a minimum of 8 patients with 2 discharges.
8 patients with discharges. Okay. To get approval or?
Yeah. So what happens is before you can bring in the surveyor, you have to have that in place. So what ends up happening with a lot of companies is that they all of a sudden don't do a good job in getting those patients.
Okay. So they don't do the marketing, I guess, huh?
Exactly.
Or so you got to have everything in place. But you mentioned so what's saying we're planning on kind of moving to Peoria, so I imagine with Glendale, I know is Sun City, kind of this area.
Mm-hmm.
Is it so? Would you say the majority of the patients are Medicare, or are they private insurances? Are they Medicaids? Do you know what kind of the community, the majority of the community is?
It's a mixture in your area, so that's a good thing.
Okay.
I mean, even in Scottsdale, for example, because I lived in Scottsdale, even in Scottsdale, you have Medicaid patients.
Okay.
So it doesn't really matter. It doesn't matter where you are, really. I mean, the one state that I have things against is Las Vegas, because Las Vegas, there's a lot of United Healthcare patients there.
Okay.
So so that's a little bit hard sometimes. And United Health Insurance actually has their own subsidiary, Home Health Agency.
Oh, wow. Okay. So they send it to themselves. Okay.
Well, not really send themselves, but because of insurance, so they can play the game. Some people accept their insurances, that's fine, but they're stringent and they really want things to be done. And if you don't do it right, they're not going to pay.
Okay. So I guess, I mean, I think we're pretty set on this. This is something I've had in mind for a while. And I was thinking about doing it here, but then I just got a lot of non-competes and I got a lot of companies I work for. And I think it would just be a big mess out here, honestly. And that's why I'm thinking Arizona. We were planning on moving there anyway, for, long term. Living. We've been there a few times. I think I told you we were looking for a house we were just there 2 weeks ago,
Mm-hmm.
And I guess what can I do right now to kind of get the ball rolling and just kind of this is what I can do this week and next week to kind of get the process started up.
Well, so we cleared the money part. You're good with that stuff. The next thing I would look at is, where specifically, what city you're going to be in. That's one thing. And then the thing that you can do as fast as possible is when you determine what city you're in, you need to have a physical address. So that's why we're talking about in the past, I was like to cut the cost a little bit lower is to get a virtual site first, not unless you want to get started and getting yourself an office already. Okay. So once you have that physical address, then I would, you can do it in a matter of like I said, if there's a virtual office space there that does have live office space as well that you can rent out once you establish your company.
Okay.
If you have that physical address, then I would move to the next step on getting your incorporation papers done.
Okay.
Before you can submit any application with the state, you have to have your incorporation papers laid out. So that's a determination if you want to do an S corp or a C corp or an LLC.
LLC. I'm assuming do most people do a LLC?
It depends. I mean, it's all up to you. I've done both.
Okay.
So, you know, for typically a lot of people, like your first jump into business is an LLC anyways. It's the closest to what a sole proprietorship to an S corp, right smack in the middle. But there's still some properties that you can take advantage of on that stuff, right? So it just depends on the, you know, what your tax filing every year is going to be, and your quarterly bonuses that you guys are going to do. So once that takes about, you know, less than about 2 weeks to get fully done. So when you have that situated, once you have your LLC, so there's a couple ways of doing it. You doing your application yourself to save you like maybe a couple $100, or you just bite that $200 and go to LegalZoom and say, all right, I want my corporation. Right, so you can go LegalZoom, you can go to
Yeah, I think I'll do that.
And with LegalZoom, what's nice is you can do everything online to do the application, so you're good with that. So and the cost for an LLC and an S corp is the same cost in Arizona. In Arizona, I think it's like $80 for there, so it's pretty cheap compared to. No, actually no.
Yeah.
No, it's actually $40 for an LLC, if I'm correct, and then $65 something like that for a or an S corp. $80 is for Alabama, because I got that mixed up because I'm working with a client right now in Alabama. So the cost is really low for that. So, you know, once you have all those things in, then you can really just, you know, jump into the main stuff. It's like, so then, you know, you go through the application process through the state. So that's where you want to concentrate your stuff on, is really just having that. But of course, before you put in your application, you know, or your corporation papers, you have to have a name of your company already.
Yeah, I'm thinking about that right now. I need a name, right? That's what I was gonna say. Yeah. Okay.
Yeah, so, and I'll trust me on this.
But
when it comes to picking names, when it comes to picking names, I've seen agencies spend months to try to figure that out.
Oh no, this probably think of that sometime today, you know.
Yeah, and
is it that important?
And so one thing that I always tell people to avoid when it comes to picking names is don't use your name.
Yeah.
Right. It really like irks me so much when I see an agency called, you know, Glory's Home Health, and you know, I'm thinking, oh, it's Glory, whatever, but then all of a sudden the name of the owner is Glory, right? So it's just, I'm like, look, you know, I mean, the only people that can create a company name under their name is like Elon Musk, all the big guys. They can create a name under their name because that's brand already. But you know, just, and also staying away from what I would do actually is I would go to Medicare.gov, and what I would look at is I would look into the agencies located in the state that you're in. Okay. And then what I would do there is I would reverse engineer that, and I would look at, you know, what are the names being used. So let's say, for example, there's a company that's called Advanced Home Health, right? The last thing you want to do is, because I've seen this done so many times, is then they would come in, there was an agency would come in and say, well, they're called Advanced Home Health. We're going to call ourselves Advanced Home Health Services. Right? So you don't want that, because guess what? When you go to, when you're marketing, you walk in and you're going to say, hi, I'm here with Advanced. You know, these people in the referral sources are going to be like, you know, it's the same. They think it's the same, and you don't want to be associated by accident with a bad name already in the industry. So choosing a name is such an important thing. Now, there's other companies out there, unfortunately, that does what they call the yellow page strategy. So back in the days, you know, when there were yellow pages, and actually people used yellow pages, there was a hack to be able to be in the number one list when on the yellow pages. You would either use a number for your name, a number first for your name, because that will get listed before the alphabets, or it'll be the letter. So that's why you see a lot of, if you ever notice around, you still see companies that are called A1 something, A1
Yeah.
groceries, A1 this, because that was a trick to be placed on the top.
Wow. Okay.
Right? So that was a hack back in the days for the yellow pages, but it's not a hack anymore. If you want, you know, it's not, A1's not going to get listed first in Google when you're ranking yourself, right? It's not, it's your SEO services, it's your blogging, it's your, you know, your pay-per-click ads and all those things. That's what qualifies that. So you have to have a name, because when you apply in LegalZoom, they were going to say, give us 3 names that you want to use for your company, listing which one is the highest thing ever. So that's where you want to put yourself in, is because they're going to do what they call a name research in your area and see which one is available.
Okay.
So
You keep saying in my area, but I thought Peoria, you know, it's like 2 million people in Peoria, no? I mean, it's a big city, or you need to get approval within each county.
What happens is it's just, typically you will choose 3 counties in your area.
Okay.
So, you know, I would have to look into Arizona a little bit more. Sometimes like, for example, in Florida, you can choose zones only. So if you're in zone 3, then you can take care of all these counties in zone 3, but you can't take care of a county outside the zone. So it just depends on how Arizona sets it up. If I'm correct, in Arizona, you can, you know, like in Illinois, for example, if I'm servicing DuPage County, right? So, and I can't go, I'm going to service DuPage, I'm going to skip Cook, but then I want to take care of, you know, something above Cook County. You cannot skip counties. They have to be adjacent to each other and connected in a way. So it just depends on the state that you're in. And you're not just going to hit one county. You don't want to do that. You want to get approved for as much counties as possible. That does not mean that you're going to service every single one of the counties. You may be approved for 5 counties, but you want to concentrate your marketing in just one county. That's perfectly fine. That's a good strategy when it comes to marketing. So you're not spreading yourself thin with workers. You're not spreading yourself thin, you know, with your marketing, and you can condense your marketing. You know.
Okay. That makes sense. I think you've given me some homework. And then also, how do I pay you? How do I pay yourself or your services?
The way we work in our company is, you know, we accept credit cards, or we do, you know, direct deposits, like, you know, for our payment services. You know, we set you up with a link, and then, you know, you can do a direct payment, so you can go to your bank or your online banking, and then we give you the routing number and all those kind of things. So it all depends on how you want to handle that. That's how pretty much we work in our company.
And is it an hourly rate, or is it a weekly rate, or is it just like a lump sum, or how do you guys typically do this?
Great question. So the way we handle it is, like, there's 2 different parts. It's like, you know, do you want us to do full setup where we're there with you all the way through, or do you want to be able to, you know, kind of just have us slowly helping you out with certain questions, and you can just bring us in if you know, for availability. So, like, you know, like, typically there's some people that want to be more gung-ho and try to do some stuff to minimize the cost. That's perfectly fine. For us to start an agency for somebody without the additional cost that you're going to need, right? You know, for a full home health agency, we charge $37,000. So some people will try to limit that cost, and I totally believe in that, right?
Yeah.
People should limit their costs, because, like, for example, doing your application for the LegalZoom, right? You can do that your own.
Yeah, exactly.
Right? And so, you know, if that's the case, what we can do is we can just start a start guidance first, where it's a lower cost. What we do is we help you out. We kind of direct you how to help find a location, just to direct you as a consulting and the right directions. So if it's in that level that you just need us to be able to say, hey, this is where you go, this is how you do that stuff, and point you the right directions. And as you continue in the process, if you want to say, hey, Michael, we need help with this, then, then jump in, kind of like give you advice. And that's where the typical packages of like, basic consults will be like $250 an hour. So add it from there. So let's say if it's just to start you up, get you in the process in the right directions rather than, you finicking around, because I'll be honest, in this industry, nobody likes to share.
Yeah. Okay.
So that's just how it is. I've seen friends fight each other just trying to get information. So if you want to be able to get the starter package, it's $5,000 for that. With that, we give you your policies and procedures, because the policy and procedures, if you purchase it outside, it's already going to cost you around $1,500.
How much? $1,500?
Yeah.
Okay.
So for the $5,000 that we do, what we end up doing for you guys is we get you your policy and procedures. So that's ready for you. We point you in the right directions. When it comes time to apply with the state, we'll help you with the application so that if you have any questions to answer that, we can even pull the application in for you. And then putting those situations in. And then from there, once we get to the next level, which is your Medicare form that you need to apply for, then we can help you fill those out as well, because we've done that a lot. And then
the Medicare form, and then the private insurances too, and the Medicaids of the world as well, or just the Medicare?
So you cannot apply for Medicaid until you have Medicare.
You need to have Medicare first.
Yeah, you can definitely apply for Medicaid, but that's the last thing you want to really concentrate. The truth is, you want to stay away from Medicaid patients. Medicaid,
yeah, of course,
is literally
they don't pay as well. Yeah.
Right? It's the freebies in our industry, meaning that if I'm working with a physician, and how do I know it's a good referral source? If he's giving me at least 30% Medicaid, 70% Medicare. If he starts hitting me with 50% Medicaid, more than 50% Medicaid and less Medicare, right? That's a loss for me, because Medicaid services, you're pretty much giving it for free almost. The profit margin for a Medicaid patient for home health is somewhere around $300-400. But if you don't manage things correctly, you can end up losing a lot of money.
Okay. So I guess the initial question I would have for you today, you mentioned this virtual office space, so I could submit the application and do this part. Is this just like online? There's virtual office spaces? I haven't heard of this before.
Have you ever heard of WeWork?
Yeah, I did. Yeah.
Okay, but of course they had a big problem, and I think they're going to go bankrupt and everything because of their setup.
Yeah, I think they're bankrupt. Yeah.
So the way WeWork works is it's a virtual office where, what ends up happening is you can just use the address and all that stuff. But what ends up happening is they also have physical spaces as well. So what happens is, at first you can say, all right, I just want to spend, a virtual office will cost you around $100, $150 a month just to use their address. But then eventually what you can do is you can eventually rent a physical address in there. But, so if you don't want to kind of tend to do that, you can jump in straight to a facility that has...
No, I don't need that, because we might not be living there for another 6 months or so,
No, I'm saying you can get a 200 square foot office for now that will cost you somewhere around $300 a month.
Oh yeah?
Yeah. You don't have to go for 1,000 square foot facility, right? You can just go for a 200-300 square foot office for now, right?
Okay. And I think it has to have 2 rooms, right? As long as it has 2 rooms.
Yeah, because one room has to be what you call your HIPAA safe area, right? And that's where it needs to be at. So that's where I was going at with you and saying that what you can do is make sure you go into an office space that is like 50% that is not full, right? Finding out that they have a lot of office space available. Just rent one office space for now. That's your physical space. And what you can do from there is, there it is from where you are. And so later on, when you're close to your approval, you can get another couple more offices in the building. Even if the couple offices in your building is maybe separate a little bit and not connected to that room, it's perfectly fine. You can just say that that room is your reception area, but the two main running rooms are over there. So that's where you can kind of put that into place. So, you know, so like I said, you know, because a typical square footage will cost you somewhere around 12, Arizona, Peoria, maybe around $10 to $16 a square footage. So, you know, let's say you get a 200 square.
It could add up, yeah. Wow.
Yeah, let's say you get a 100 square foot room, just like a small room for now. You know, 100 square foot times, let's say 200 square foot. So let's say it costs you $10 a square foot. So 200 times 10, that equals to what, like 2,000, right? And then you divide that into 12 months, and that's how much your monthly payment is going to be. So, you know, that's how you live your cost. And then the next thing you look into is your phone number, right? Is like, how do I have a phone system and everything? So what I would do for phone numbers, because you're not over there yet, is I would get a phone with a voice over IP phone. So a lot of agencies sometimes when they first get started, what they end up doing is they just get a cell phone and use that number for their application. But the problem with that is once you're running, that number is already established with your company name. So everywhere in the internet already has that number, and calls are going to be going into your phone number, which is going to cause problems later on, because, you know, once you expand, you know, for you to be able to change that, you know, mess things up. So you can go with a company like Ring Central, like what we're using right now. And they have a phone system for like $65 a month. They give you one phone already. They actually do a physical phone itself that you can plug in any.
So this is like a dial phone. This is like a business phone. It's not a cell phone.
No, it's a literal physical phone that you can plug in any Ethernet port. But what's also nice with Ring Central is you also have an app, and so when you go to your app, you can even receive your phone calls directly to your cell phone, so that when you see that somebody calls it, it's a business call. So, you know, you can set things up that way as it goes, and you can expand by adding more numbers and more units as you expand. But what that happens is, at least you have a phone set up already, and you're not losing chances. So, you know, you can you can even start off with a package that's like $29, and you know that's with the free you know, VoIP phone, but you can use the app, but at least you have a separate number. And then once you're fully open, then get the additional VoIP phones, and then now you're set, right? And it's actually cheaper. I mean, you know, if you, like for my companies, I use the VoIP phones because what ends up happening is, if you get one of those bundle packages, it's gonna land you somewhere around $300-400 a month, right? Whereas this one's like I paid a high rate, the $65, because I have more phone lines, and also I have that set up, but then all I have to do is pay internet. You know, from my so that's all that you have. And like, what's nice is, like, this thing that we're doing right now, this comes for free.
Oh, okay, great. Okay.
So if you probably know,
this is part of the Ring Central included package. Okay.
Yeah, it's a Zoom meeting. They use Zoom within Ring Central. So there's so much stuff. So like this one right here that we're doing, a lot of agencies are messing up right now because they can't talk to people. Well, we have the Zoom, and we can contact a lot of referral sources and say, hey, let's have a quick Zoom meeting for 15 minutes just to say hi, so we can talk. So, you know, that's just ways on being able to handle that stuff. So like, literally, like I said, name of your company, get your physical space and address, make a determination for that. And what's nice is with this whole COVID thing, you're going to get some good rates for office spaces. So even if you go for an office space right now, there's potential chance you have a better rate.
Yeah.
You can even try to suggest to them and say, hey, we're just starting off, we're in Illinois, but we want to get started. Can you give us a good rate on our first year for the lease?
Okay.
You're like, I don't mind
at least for the first year.
But give me a deal on my first year. We're not open yet. We can't open for another year and a half. So the application process, then you defer the payment so that the first year is very low, and then we don't pay expanding later on. But
right,
a lot of that kind of work. For our one agency, we were able to talk to a company place that they didn't let us pay for a year.
Oh wow! Okay.
They didn't let us. They didn't let us pay for
to find out this call around then, huh?
Yeah, I don't think you're gonna get that type of a rate that we got. That was what 14 years ago. But you know,
okay.
This is actually is a good website. LoopNet. I think it's loopnet.com or loopnet.net. But loopnet.com, it's a commercial real estate website. So you can actually find offices in the different areas.
Okay. So let me just start out with all this, and I'll probably definitely need the policies, procedures, and all that, and I definitely got to overthink the name now a little bit, and I was probably thinking something easy like Premier or Pro Home Health Service, something easy, you know what I mean?
Sure.
But
and when you go for that, the next thing another good way to know if your name is good to choose, right, is literally going to GoDaddy.com and seeing is the name available on, is the domain name available? Because the reason for that is you want everything to be congruent. So you want even your website to match with that. So it's easy to be able to find, because like how many Advent home health agencies exist in the US? So when you go to their website, one of them says adventhh.com, adventhcs.com, because they're competing for one name. So you want to be able to kind of see. The problem is a lot of people don't look at the whole thing as a big picture. And most people try to start their company from the ground up, when the truth is you need to start your company from the end and going to the front. That's the best way to be able to look at your company, is not saying, okay, I'm going to do this to move up. No, I'm going to start like, what's my ultimate goal? And from there, how do I reverse engineer it to figure out how I begin from how do I start and I begin this process?
Okay. Yeah, I think that helps me a lot, and I think I'm gonna start to do some research today, quite a bit of research, since I have nothing but time the next few days, and I'm gonna call around. And I guess my last question is, I think on the application, I was reading it over, it says I need to have a physical therapist, a social worker, a home health aide. Obviously we're nurses. I could easily put down our names for that part of things. How about for the therapy part? Do I need to find an employee?
Yes and no. So number one, to add to that, the thing that you need to do is, do you and your wife already have Arizona licenses?
We're filing them today, essentially.
Okay, good.
Yeah.
So that needs to get started, because you can't even start the application because you're using your name as an RN, so you can't say I'm putting application, but I still have an Illinois license. So you want to be able to go to the AZBN, whatever. I forgot what their website is. AZBON, I think it was. So for physical therapy, what I would do is I would search online. So like your company, for example, you guys outsource a lot of your physical therapists to outside companies. So what I would do is I would reach out to physical therapy agencies that works with home health agencies. I would want to actually go for a facility that has PT, OT, and ST in it. So it's a one-time hit. I want to go for 1 or 2 of them, and I'm gonna say, hey, listen, just to let you know, you're gonna tell them we're gonna put an application in for a home health agency, and so we want to start creating our contracts with people, and so we're reaching out to you guys. When we put our application in, do you have anybody that we can use to put in our application, because that has to be part of it. And so since we're not hiring people, we're going to be outsourcing everything. I want to reach out to you if you guys have that. So right there alone, they'll literally give you, physical therapy licenses and everything like that of these people, so you can put in your application. The home health aid, and that's the one where you're gonna have to go to Indeed, and you're gonna say, look around from there. One thing I would ask is your brother-in-law, who owns a group home, is the group home manager a CNA? If they are a CNA, a nursing assistant, you can tell your brother, hey, listen, we're putting this application. Can we speak to your CNA? And
no, she's a nurse practitioner. His wife is a nurse practitioner, so she runs that business, and he does a cabinet business. So they're like, she does.
Who takes care of the patients in the house?
Well, right now she does, the nurse practitioner. She lives there right now.
She'd rather work with the patients than work as a nurse practitioner? I don't get it.
She does both, yeah. She does virtual visits right now.
Okay.
Yeah, but I guess they had somebody and they took off. They said, forget this. They flew back to Jamaica. So, yeah, but I'm gonna find somebody. I think they have somebody else as well. So I'm gonna look into that, and I think we could talk to him, and whoever he hires next, we'll just put on the application.
Yeah, you just do that, and and you can tell the person, like, hey, listen, or you can put in an application, have people apply with you, and you're gonna say, hey, we're still in the opening process, but we want to have you on board. Once it's open up, we want to be able to have and offer you this job, but this is the information we need. They give it to you. If they end up not being your CNA when you open up, or when you start seeing patients for your application process,
that's fine. Yeah,
perfectly fine, right? So that's pretty much it, man. I mean, that's a lot.
Yeah.
But the problem is, if you can't do all that in a matter of a week, then you're gonna have problems, because you wanna do all that in a week. Location, and then get those can be done. Actually, all those things can be done in one day, rather than and sometimes, like I said, people will wait a whole month, because we get those things in. You can get your incorporation papers, your FEIN, get your NPI application, NPI number, get that within 2 weeks. We have that physically now. Then we can go ahead and submit an LOI, a letter of intent, with Arizona, to say we want to open up an agency. The process of bringing the application in for you.
Okay. Yeah, that makes sense. I mean, there's a lot of things on this list I need to call around right now and just get started on it and get the ball rolling here. So.
Sure.
Yeah, there's a lot of things I could do, obviously remotely, just making phone calls, calling different places, and one thing at a time, I guess. So I'll try to get all this done. A lot of this done today and tomorrow. Well, today I gotta take care of a few things as well. Obviously, we can't go anywhere. So, but yeah, for sure. And I guess as far as, I'm pretty sure we'll probably need those policies, procedures, and that Medicare part, that's definitely something we're going to need. So I'll try to reach, I'll text you, I guess, when I get that taken care of, and you could, I guess we'll go on to the next step,
Yeah, and I forgot to tell you, on that 5,000, included in that is your website already, to set up your website. So you get your website set up, and then you get a year access to our 10xpatientreferrals.com website, which has all the training on how to market your agency. So, because you want to get your learning curve started now. So you get a year access at our 10xpatientreferrals.com, information. So you have access to the videos there. You start learning how to market. So you're getting yourself ready, because you want to get yourself prepared. So like I said, the 5,000, your policy and procedures, the basic setup, consulting to get you started with, answer your questions for the, you get up to 20 hours with us of conversations with that. You get your website set up, and policy procedures. So you get all those things for that initial stuff, just to it's pretty much to jumpstart you with your company.
Awesome. I love it, man. I'm like excited here, sorry, ready to like get on it and jump on it. You know what I mean?
Awesome, man. So get the stuff done, man, and we'll just go from there.
Yeah, so I'll reach out to LegalZoom and we'll think of a name today and everything else. And I'll check GoDaddy for domain names. So awesome, man. Thank you so much for your help. And I'll be reaching out to you for, is this just going to be included in the $5,000 fee for the start here?
I'm sorry?
Our conversation here today, is this like a consulting fee or how does this work? Just it's included with the overall start, right?
No, this is included because you're friends with Benji.
Oh, okay. So yeah. Benji told you I'm running out to every hood in Chicago, huh?
Yeah, you know, Benji said, hey, I'm going to give your number to somebody. Benji doesn't give my number just to anybody. So well, I know Benji does not give my number to people who he competes against in Illinois. But since you know, you're going to Arizona, he's like, yeah, here's Michael's number because
here you go ahead, take it, yeah.
Yeah, so it's no problem at all, man. But yeah, so that's pretty much it, man. But if, you know, once you get the ball rolling, if you have any questions, let me know. And then if you really want to get the ball rolling and started, you know, once you get the basic stuff right here, or even just assistance on this stuff, let me know, and we'll go ahead and get started with it, man. Okay.
Okay, awesome. Let's do it. And are you in Arizona or are you in Chicago?
I'm in Florida now. I left Illinois.
Oh yeah.
I left Illinois 2 years ago.
Okay.
Arizona, I lived there 2006 to 2009.
Okay. Wow. So you got out of there quick though, huh?
Yeah, well, you know, I got called back to come to Illinois because our business was over there, and my parents were like, we need you back here.
Yeah.
You know, vacation's over. You met your wife over there already, so get your butt back here. You know,
come back over, huh? Okay.
Yeah. So you know, end up back in Illinois, and I was running our agencies over there in our school. We used to have an LPN school in Illinois.
Really?
Mm-hmm.
Oh my God, you guys have done it all, huh?
Yeah, I mean, you know, like next month I'm launching passNCLEXnow.com, which is a website for nursing students to pass their NCLEX. So I actually coached Benji's wife to pass her NCLEX, to get her over the hump.
Awesome.
She was having problems. She didn't pass, and she was like, I knew she was smart. I'm like, you're smart. I was like, I don't get it. You know, and so it was just literally mindset for her. And when I sat down with her for a couple hours, I said, this is the mindset thing. And it was sometimes it's just mindset, you know it with the NCLEX, right? So I just had her mindset, and so ever since then I was doing one-on-one coaching, especially for my students for the LPN. So I was like, I've owned the domain name Pass NCLEX Now for the past 12 years, and I never did anything.
Oh wow!
Yeah, I never did anything with it.
That's a good name.
Yeah, it is.
Yeah.
It is actually. Yeah,
that's a really good name. I like that name.
I actually had a company offer me $20,000 for that domain name.
Really?
Yeah, I had a company.
Because that's a real good name, you know.
It really is
that's a real good name, man.
Yeah, so I'm just doing multiple things, man. But I mean, the home health is my passion. I love the health industry, so I think it's a good choice. Arizona's a good choice. Get started and contact me, and then we'll.
I love it too. Yeah, but no, I love it too, man. Home health is awesome. I don't know. I wouldn't work anywhere else, honestly. But I'm thinking I might have to start working in like a nursing facility for a little while once I go over there. Because I can't just apply for jobs for home health over there, while I'm trying to open up my own business,
Yes, you can.
So, yeah?
Yeah.
Just don't sign any non-competes, right?
Yeah. If somebody says, you have to sign a non-compete clause, I'm like, no, I don't sign non-compete clause. I'm not. Yeah. And then if they say, well, we can't offer you a job, that's fine with me.
Yeah, exactly.
That's fine by me.
Doesn't matter.
Yeah. And you can say something like in this case, if they sign a non-compete clause, you can look in the non-compete clause. If there's no timeline in the non-compete clause, technically it's invalid.
Mm-hmm.
There has to be a set limit amount of time.
Oh yeah, okay. So that's
maximum of 12 months, nothing more than 12 months. The reason why I know this is because I've dealt with a lot of lawyers, so. So
Yeah.
if your non-compete clause, it doesn't even have a timeline, then it's already invalid. You can challenge that in court anytime, right? Number two, most agencies are not going to try to go after you. It's just the truth because it's going to cost them money. It's not like there's a lawyer that's going to say, yeah, I'll fight for you for free, and then just pay me when you win. It's not going to be that way. So agencies have to pay $5,000-$6,000 for a lawyer to try to go after you. And the next set is, if you do sign a non-compete clause, then all you got to do is not go after the current referral sources of that facility. Because if that facility is not, there's so many doctors you can go after, right? And no facility can say that they own a particular facility. It's not a competition because anybody can jump in there. Like, I'll give you an example. I use a software, right? I have a software that I use. This is a hack in this industry. And a lot of agencies don't use the software. There's a software that, what happens is you can jump into the software and I can find out which doctor in which area gives the most home health patients, Medicare patients.
Really?
Mm-hmm. Yep. And then taking that information, I can find out which agency he's referring to, how many patients he referred to those agencies, what type of patients are they.
Wow.
So,
that's a really good thing to know.
So so I'll look at it like, okay, if I see a doctor only referring to one agency, I'm not going to go after that doctor because he's set in his mind. But if he's sending patients to 5 agencies, then I'm open to jump in. So, and of course, that software costs like $10,000 a year, but it's worth it. You can find out hospital information. You can find out nursing home information. And so you know who your rich targets are. Because I've used that for a non-compete clause fight, and they said, well, I'm like, listen, you're not even their number one choice. They refer to 5 other agencies other than you. So it's not a competition. So that's what I'm saying is like, there's way around it. Don't let it get to you. But if it really is smart, just don't go for a company that does a non-compete clause.
Sure. I will keep that in mind. And I'm going to go get things started over here, and I'll yeah, man. This thing is driving me crazy. We've been stuck in the house here the last few days in this apartment here, and it's tiny. And we're like
where are you located? Is that in Downers Grove?
Yeah, we're in like Woodridge right now, like by the Seven Bridges movie theater.
Oh, okay.
Like,
so, I used to live next door then. I used to have an apartment off 63rd behind the gas station.
Oh, I know that area. Yeah.
So actually, my apartment was next to your apartment. You're in the Medley or something like that apartments?
Emily, yeah.
Yeah, okay. So mine is next door to you.
Yeah.
You live there.
Yeah, we're new here. I sold our house. I was counting out a housing crash, but then it never really happened yet. So I'm still waiting on the housing crash. So hopefully it comes soon. I kind of sold our house at the height of the market here. So I'm hoping that within the next 6 months or so, the foreclosures start running in again, so we'll see.
It's going to happen in Arizona. It's going to be there soon.
Yeah,
it's going to happen.
Yeah, I think so too.
Arizona's just so perfect, man.
I'm counting on it. I thought it would come a lot sooner. Yeah, I thought it would come a lot sooner, but I'll be patient. I'll wait it out,
All right, man.
All right, awesome. Let me get things settled in here, and I'll get it started, I guess,
All right, man. You take care, right?
Thanks a lot for your time, man. I'll talk to you hopefully next week, okay?
Awesome. Take care, man.
All right, take care, man. Bye.